I'm going to get started. I know how incredibly busy everyone is. I know that the Assembly has a meeting going on today. I know that some of you are really comfortable with using this technology because I got to do the first Law and Public Safety Committee hearing yesterday by Zoom. Everyone did a great job on that text. Thank you guys for making sure that we still have an opportunity to move meaningful legislation forward in spite of these interesting times. Again, my name is Patricia Teffenhart. I'm the executive director here at the New Jersey Coalition Against Sexual Assault, or NJCASA. For those of you who are a little less familiar with us, NJCASA is a recognized statewide and national thought leader on issues relating to sexual violence. Our membership is comprised of New Jersey's county-based rape crisis centers, and our goal is to elevate the needs of those service providers and the 1.8 million survivors who call New Jersey home. We work closely with our policymakers to ensure that together we're advancing survivor-centered, trauma-informed policies that reduce the impact and prevalence of sexual violence in New Jersey. Today, we'll be hearing from a few of our colleagues from throughout the state, specifically sharing about the impact of COVID-19 on survivors of sexual violence and those who provide their services 365 days a year. I'm so incredibly thankful that many of you have joined us here today, and we are recording our session so that we can share it with those who were unable to attend. I'm going to start by introducing my colleague, Alex Mamina, who many of you know at least by name. She is the brains behind our monthly policy emails that are sent to all of your legislative offices. And Alex is NJCASA's Research and Communications Coordinator. I want to thank Alex for helping to organize today's call and invite her to do a quick roll call. Alex, I see you, but I think you need to unmute. Oh, she just messaged me. She's having audio difficulties, so she's going to call in. So we will skip that because we are all about improvising right now in times of COVID, and we'll come back. No need to, oh, that might, no, that's not her. Okay, so we're going to keep going. I want to lay the foundation for today's call by sharing a bit of information regarding the work that our local programs have done over the last year. In 2019, our member programs answered over 10,000 hotline calls. Advocates went out on over 1,300 sexual assault response team accompaniments, meeting survivors in hospitals and police stations immediately after victimization. Our programs provided counseling to over 7,500 survivors and their loved ones. And sexual violence programs engaged with their local communities at over 1,800 events, including trainings, workshops, and conferences. Yet despite all that we accomplished, we need a greater investment to serve the 1.8 million survivors who call New Jersey home. This reality is underscored by the fact that in 2019, 43% of sexual violence programs had a waiting list for counseling services. And now in 2020, we find ourselves, like everyone else, quickly adjusting our services to meet the needs of our communities. When collecting data for New Jersey's first ever statewide sexual assault needs assessment this past summer, only 5% of service providers indicated that they had provided virtual services at that time. In a matter of weeks, like the rest of us, this has drastically increased to 100% in response to COVID-19. Today, we'll be hearing from some of our colleagues on the front lines as they share highlights of the opportunities and challenges that exist while serving our communities during COVID-19. But first, as you all know, having strong, transparent relationships with policymakers is essential for advocacy organizations. Together, we've done so much to advance survivor-centered policies, and we're incredibly thankful for your ongoing leadership and support. And one of our greatest supporters in the state legislature is joining us today as our special guest, Senate President Steve Sweeney. Senator, would you like to kick us off with some brief remarks?
Thanks, Patricia, and thank you and NJCASA for all the great work that they do. Now, actually, more than ever, because we're all locked down and we're very concerned about domestic violence. Tempers are going up, and I'm sure domestic violence is going up also. And just because we're locked in doesn't make an excuse to abuse someone. So, this organization I'm a big supporter of because, we look at the results that come from it. And, this is a value-based investment that we make because it does the Lord's work. So, Patricia, thank you and everyone involved. We're going into some really tough times financially. Organizations like this cannot be lost, in the mix. With that, I know you got a big agenda. I'm more than happy to listen.
Thank you so much, Senate President. We've been incredibly fortunate to have your ear and your heart during the tenure of my leadership role here. Together, we have really done groundbreaking work. We are looked at by our colleagues across the country as being one of the most progressive states when it comes to advancing survivor-centered trauma-informed policy and appropriations. And to your point, I actually didn't include this in my stats, but it is important to note that over the last month, the National Sexual Assault Hotline has reported a 50% increase in hotline calls being made by minors. And so we know that the safety nets that exist for vulnerable children in particular are really challenging for young people to access right now. For a lot of young people, being able to leave their home to go to school is a way for them to safety plan, have access to supportive adults who can help them cope and navigate challenging home environments. And those safety nets simply just don't exist the way they normally would. And so it's so important that our frontline providers can access to hotline and trauma-informed counseling, and that we're there so that when the fog lifts and we start resuming life as normal, whatever that looks like on the other side of COVID-19, we have the robust service infrastructure that will be necessary to meet the needs of our communities. And I'm so proud of the 3 providers that you'll be hearing from today. I think they will help alleviate any concerns our colleagues in the policymaking space may have around service provision during this time, but also they're incredibly candid in being able to identify, sure, we're still here and we're operating, but it's not without its challenges. And I want to recognize also, as a compassionate colleague of all of yours that are doing this work on the front lines, it's not without a personal toll as well. We've talked often within our membership at some of our virtual office hours over the last couple of weeks about what it looks like to now be providing counseling from your dining room table or the corner of your bedroom, places that used to be safe for you, a refuge for you as you're coming home from a trying day, helping other people navigate their trauma. And now that trauma is actually entering your own homes. And that will come at a toll for our providers. And so NJCASA is paying close attention to the vicarious trauma that our providers will be experiencing and making sure that we are there to provide support to all of you as you do this incredibly important work on the front line. So on behalf of all of the team who's here today from NJCASA, thank you to the providers who are doing this work locally across the state. We recognize how challenging this is, and we're so incredibly appreciative of all that you do. We're going to start today's conversation by hearing from Jill Zinckgraf, who is the Executive Director of the Domestic Abuse and Sexual Assault Crisis Center of Warren County. Jill also serves as the chair of the NJCASA Board of Trustees. So if anybody has any beef with me, you could take it to Jill. She's my boss. But also if you have anything really nice you want to say about me, you can also take that to Jill because she's my boss. Jill has been on the front lines of this fight for a very long time, and she's going to share with us some information about what it's like to be an administrator of a 365-day-a-year, 24-hour-a-day organization, which is challenging during the best circumstances, and you add the impact of a global pandemic to the mix, and it's just become a little bit more interesting. So Jill, if you tell us a little bit about what it's like to be you, that would be great. We'd love to hear from you.
Hello, and thanks, Patricia. And I want to thank all of you for giving me the opportunity to share some highlights and really spotlight the work that's coming out of the local agencies as we continue to respond to the needs of our communities. My name is Jill Zinckgraf, and I'm the Executive Director of the Domestic Abuse and Sexual Assault Crisis Center of Warren County. And we've temporarily expanded our services to serve survivors in our neighboring county of Hunterdon. And as you've heard, I'm also the chair of the Board of Trustees at NJCASA, and Patricia's colleague, not her boss. I know I can't speak for all agencies. However, I've been a part of many meetings in which I've learned from our sister agencies how they're responding, pivoting, and creatively problem solving constantly as the information continues to filter into us. We have felt a great tectonic shift in our micro and macro ecosystems, as have all of you. And today, more than ever, we are challenged in what has been termed a VUCA environment, meaning we are working within a volatile, unpredictable, complicated, and ambiguous environment. And over the last 8 or so weeks, I have felt both exhilarated and terrified at the same time, as I've been challenged with problem solving, decision making, subsequent action taking, when no right answer exists, or at least it doesn't exist for long. The community in which we serve deserves to see the local agencies respond in a way that is adaptive, reflective, and allows us to reinvent. And we started to scramble to stabilize, and today we have calibrated to maintain and even in some cases thrive. And soon we'll be adapting again to our new environments. And my words will not express the deep gratitude I have to Patricia Teffenhart and NJCASA's leadership through the last 8 weeks. It really has been an incredible time. What I'd like to share with all of you is that we've had to reconfigure how we serve the needs of survivors. Within 48 to 72 prior to the stay-at-home orders, we were able to go from traditional counseling and advocacy at our outreach offices, courthouses, police departments, and hospitals to completely remote services via telephone, voice over IP, and teleconferencing systems, which have required a tremendous amount of research, policy writing, training, and implementation. And today we are operating at full capacity. I am compelled to mention that our 2020 fundraising efforts to date have been adversely impacted. According to an article that was released just yesterday from the nonprofit Times, 20% of donors are reporting that they will not donate until the end of COVID-19. And those that plan to give are reporting to give less in the near future because of the uncertainty of the economy and their own jobs. And we are certainly seeing this at the local level. Normally, by this time of year, I've raised approximately 50% of my fundraising budget. And today I'm at 31%. This is problematic because we rely heavily on these dollars. Approximately 15% of our operating budget rely on these dollars. I know that in the past we've been asked to do more with less, and we have because that's what we do. However, respectfully, this cannot be that time. Our budgets run lean and the demand and need for services is increasing. I'm feeling the pressure to be able to respond appropriately to the community and its evolving needs, while simultaneously continuing to support the staff and their needs, all of which require this funding. And we have been challenged through this crisis. However, I want to highlight that for every obstacle we have confronted, it has brought great opportunity. The ability to reach a broader community through technology has been amazing to observe. Additionally, what those of us that work in the field have always known to be true, and that has been highlighted through this pandemic, is that survivors of sexual violence need designated shelters that are able to respond to their unique needs. This is a good time to start having those conversations. And as we continue to move forward, I want to share that I've watched staff stretch and see beyond the immediate needs of the agency and look, identify, and respond to the needs of collaborative opportunities in the community. What has been most notable, at least for me, but I suspect many will agree, is that every single member of the team, regardless of their title, has taken a leadership position, highlighting and affirming the importance of every single part of the whole. And so I would also like to say that I am so very grateful to all of you for your leadership, all that you're doing on behalf of all of us at the local level. From my view, I will tell you I feel supported, heard, and so very fortunate and honored to be doing this work during this time. And so thanks for the opportunity to share.
Thank you so much, Jill, both for joining us today and for what you do to support your staff, your county, and the movement as a whole. I want to take a moment to point out that Jill has just completed her EDD in organizational leadership from Stockton University. It probably seems really thematically appropriate given the kind remarks that she offered, thinking about every single moment of her team. And Jill, like many others, has had this milestone impacted by COVID-19. And I know that she was looking so forward to wearing her cap and gown and walking across the stage and celebrating this huge accomplishment. And so if you all join me, I know you're all on mute, but if you could just clap and show her some appreciation. She really does walk the walk, not just talk the talk, and making an investment in continuing her education to look at organizational leadership theory and watching that be embodied in Jill's actions, both as the executive director of her local program, but also as the chair of our board, has been inspiring. And I'm so proud of you. And I'm so thankful that we all get to benefit from your brilliance. I also now want to take an opportunity to introduce you to another amazingly brilliant colleague of mine. You're going to be hearing from Karen Lopez, who is the confidential sexual violence advocate manager for the Passaic County Women's Center. What we all know is that we can't do this work alone, and no part of our service provision makes that more apparent than our county-based sexual assault response teams, which are coordinated community systems comprised of both of advocates, forensic nurse examiners, and our colleagues in law enforcement. Karen is going to share a bit about the way this community response has needed to change in order to keep survivors and providers safe in light of COVID-19. So Karen, can you unmute your line and share some information with us?
Yes. So echoing my colleagues and Patricia, thank you all for the support as we look for innovative and creative ways to support survivors of sexual violence in this pandemic. I want to add as well that Patricia's right, most of our safe spaces have been impacted by COVID-19 as we work from home. A lot of us are working remotely, but NJCASA is a lot of our safe space. You know, we are provided that opportunity to share what we feel in our challenges. So thank you, a special thank you to NJCASA. What we know is that sexual violence has not ended. And while in our county, our hotline has seen a decline in survivors seeking support, and the amount of SART services sought by survivors has decreased, as reported by our county SART coordinator, we understand that it's not because sexual violence is no longer an issue. The why is what as advocates alarms us. We understand that survivors may not be safe physically and or emotionally in their homes. There's also an inability to access technology, particularly in our impoverished areas. There's a limit to the amount of technological devices available in hospitals and in homes all around. There are a myriad of real life challenges that most people are facing. That coupled with the fear of contracting COVID-19, to have a safe kit and or rape kit performed, the terms are used interchangeably, which usually happens in a hospital, is also keeping people from seeking services. In addition, the process for the most part has a long way to go before being survivor friendly. It is challenging for us to show the type of compassionate support that has become our standard through a phone or video connection. We have seen a decline in the number of survivors that are seeking safe kits, medical prophylaxis, law enforcement intervention, and or confidential advocacy. That is attributable in part to the lack of devices available in hospitals that are contracted to perform SART services, especially the lack of access to confidential advocacy. It is also due to the amount of cases that are reported to us, the Passaic County Women's Center. Since mid-March, we have had one activation that we participated in as advocates. The survivor was not provided a confidential space to speak with me, so that limited the exchange. During the follow-up call that I gave her the following day, she voiced concerns over being in the hospital and how that could have jeopardized her health and the people that she lived with. In light of COVID-19, we have had to rethink and restructure advocates' roles. We restructured how advocates provided to survivors of sexual violence. We worked with our county SART coordinator to come up with a plan on how to offer telephonic advocacy to our county survivors of sexual violence. We found creative ways and innovative ways to bring awareness to Sexual Assault Awareness Month, much like a lot of our other agencies. We rely on that month to provide us with some some donations, and that's been impacted as well. We focused on spreading the word that as a program we are still operational and providing services. We have outreach police departments to spread the word. We have spoken to some judicial entities to inform them on what advocacy looks like during COVID-19. We have taken advantage of some of this time to really work on all of the aspects of sexual violence, not just sexual assault. One of the awesome accomplishments we undertook during our virtual 30 days of Sexual Assault Awareness Month is writing open letters to survivors of sexual violence and teaming up with William Patterson University and participating in Take Back the Night. The work has been phenomenal. We have also encouraged our volunteer advocates to participate in all of the virtual events. Recruiting volunteers has also been a focus. I have been providing training to community partners that do not work with domestic and/or sexual violence on domestic and sexual violence to raise their level of awareness and information. Our goal really has been to spread the word that PCWC is still open and operational during this time. Our paid and volunteer advocates really have been fantastic with how flexible they have been during this time that is constantly changing. Again, thank you for your support during this time. Without that, none of this would have been possible. Thank you.
Thank you so much, Karen. As Karen was speaking and I'm thinking about her remarks in comparison to Jill's, what I want to call into attention is the tremendous amount of mental energy providers are using right now in order to provide services as consistently as possible. That this is challenging work regularly, right? Hearing and absorbing other people's trauma and helping them navigate pathways to justice and healing is always hard. And none of that looks like what it usually looks like for us. And so the amount of creativity and tenacity that our local providers have been exhibiting and using is really a testament to your collective commitment to survivors. And, you know, as Karen's sharing information about how we've had to shift crisis advocacy and the role of volunteers and advocates during all of this, I want to also just give a note of appreciation to our colleagues in Essex County and to Orly Martinez on our team at NJCASA. We recognize that a lot of our volunteer advocates really find meaningful purpose by providing services to survivors. And we've had to adjust those limitations in light of COVID. Whereas usually we would be attending in person in a hospital while a survivor was having a rape kit done and being there to offer that person-to-person compassionate response. As Karen talked about, we've had to limit that to mostly virtual support. And we've also then limited the number of ways that our volunteer advocates can feel meaningful and useful at this point in time. And again, we know that once this sort of lifts, we're going to need our volunteer advocates more than ever. And so tonight and next Wednesday, we're going to be providing 2 virtual volunteer celebration events for all of the confidential sexual violence advocates that do this work across the state. This isn't easy volunteer work. It's a minimum of 40 hours of mandatory training in order to get in the door. And even then, not everybody makes the cut, right? We're looking for very specific skills and traits that would make someone good at serving survivors in a crisis. And so we want to make sure that we retain our volunteer pool, and we want to make sure that we know how incredibly appreciative we are of all that they do and that we need them. And so tonight we'll be having our first virtual session. We have almost 40, last I checked, we had about 40 people registered, and we have about the same for next Wednesday afternoon. The Attorney General is recording a video of appreciation so that we can share that with all of our advocates because they work so closely with our colleagues at prosecutors' offices and forensic nurse examiners. And so while we get to work very closely with those paid professionals on the front lines that work at our local programs, we know that they couldn't do their work if they didn't have the support of their volunteer advocates. So Karen, thank you for being so creative and thinking so intentionally about how do you continue to support those that have been supporting you and your survivors in Passaic. And just as there is a Karen in every county, there's a Jill in every county, and there's a Jeanne in every county. And so next we're going to hear from my very dear colleague, Jeanne Manchin. She's the program coordinator of the Middlesex County Center for Empowerment. What I want to draw to attention also is there's various structures of our county-based programs across the state. There's no sort of cookie cutter approach. About half of our programs are dual programs like Jill's, providing both domestic and sexual violence services. Some of our programs are actually part of large healthcare institutions. So they're just a small, tiny program within a very big bureaucratic system. And Jeanne, the Middlesex County Center for Empowerment, is one of our 2 county-based programs that's actually part of county government. And that comes with all of its own complications, but also opportunities. Generally speaking, the freeholder board isn't holding up salaries because a contract has been delayed and being finalized by the state. But on the other hand, particularly for Jeanne, she's part of the health department. And as you all know, health departments have been a little bit busy during COVID-19. So how do we continue to hold survivors of sexual violence in the space of priority when very understandably you're working within the midst of a community health department that has so many other priorities that are competing for their needs? And Jeanne's program has done an incredible job through the years, creating really innovative, trauma-informed and unique ways to serve survivors. They've been doing forest walks and yoga trauma sessions. And so she's going to talk a little bit about what direct services and how counseling sessions have had to change in light of all that we're experiencing. So Jeanne, if you can unmute yourself and share some information with us, that would be great.
Thanks, and I want to thank you also for the support of NJCASA and this opportunity to speak with you all today. So as we've already mentioned, we've had to move to a fully virtual service delivery system, which took time and is not without its complications. First, ensuring all of our counseling staff had the technology, and for those working from home, the bandwidth. Then choosing a secure platform that meets the Violence Against Women Act, Victims of Crime Act standards that are stricter than HIPAA, and setting up technology for digital signatures of client forms. In the beginning, all we could do was offer telephone counseling sessions, and some clients did prefer to wait until we were able to either offer in-person or video counseling sessions. Group sessions also waited until we had a video platform, but we've maintained connection with our clients by providing pre-recorded webinars and weekly emails on coping skills. Those groups who are now able to meet voice how grateful they are to be able to meet together despite the pitfalls of video conferencing. We're getting creative with offering a continuation of our arts and wellness groups. Our crochet group that had already begun before the crisis is now meeting virtually, and forest therapy walks are being offered virtually as well. The challenge will be how we do some of the other groups we had planned, like gardening, quilting, etc., since we would normally have provided not only the materials, but the space for these groups. We're looking into how we can safely provide these materials and facilitate work with them virtually. Many of our community partners are offering virtual services, so yoga and storytelling workshops will continue, though we're aware that virtual services are not ideal for all clients, since some will not have a suitable home environment to participate in them. We also offer one-time workshops on wellness topics, and those are now being revamped to address the unique challenges of COVID-19, like nutrition, COVID-related support, and resources. These times have been a great opportunity for us to see how clients are putting the coping skills we've already talked about to use. Many have sent us pictures of the crochet they've been doing, the masks they're sewing, and have let us know that they're doing a lot of writing and journaling. We've also found that some of our clients who had a harder time making their appointments in the past due to work, family, or transportation issues are better able now to attend their individual telephone or video counseling appointments. This has been especially true of our Spanish-speaking clients. Our bilingual counselor has reported that many of them are able to attend more consistently and do deeper work as a result. It's likely we'll continue to offer some form of video counseling even when we're able to see clients in the office again, since for some it is ideal. We are ever aware, though, that stay-at-home orders put some of our clients at more risk, as they may be at home with unsupportive or worse, abusive family members. Some, too, have found themselves unemployed, food insecure, or homeschooling children. Still, many are essential workers who are dealing with the added concerns about exposing themselves and family members to the virus. Survivors have had their legal cases delayed, found it more difficult to get the child support they require. We know that times like this can be even more difficult for trauma survivors, as it intends the feelings of being unsafe in the world, stripped of control over their well-being. Many of our clients are experiencing increased anxiety and depressive symptoms, and we're doing much more suicide risk assessments than we had pre-COVID-19. We expect we're going to see an increase in survivors needing services once the pandemic is over for all these reasons. The question really is whether we're going to be able to continue to have the capacity to do so as the county, state, and federal government get ready to make tough choices. So that's why I really appreciate this opportunity to continue to ask for your support.
Thank you so much, Jeanne, both for joining us today and for all the work that you've been doing. I've had the good pleasure of working with Jeanne for my entire tenure here, which is, really not that long in comparison to how long some of my colleagues have been doing this work. But over the 6.5 years that I've had the opportunity to work with Jeanne, I've been impressed with your continued desire to grow, both as a professional, but also as a professional within the movement, to think creatively about things like forest therapy and yoga and how we can be really innovative in how we're supporting survivors. And I know that you don't like the spotlight, which makes your agreement to join us here today even more special, because the work that you're doing deserves to be celebrated and centered. And there's nobody better to talk about the good work that you're doing in Middlesex County than you. I'm so thankful that you're doing this work in Middlesex, and that we all get to benefit from and learn from all of the lessons that you share with us. So thank you for being you and for joining us, and just for continuing to do really innovative and inspiring work. I really appreciate you. I want to thank all of our providers for sharing a bit about their work and the realities that exist for survivors during this trying time. There's so much that we've learned from each other over these last couple of weeks as we've been engaging in virtual office hours and continuing to do our work with different segments of our service provision areas. And I feel like when this is all over, we will be better for having gone through this. There is a general consensus that going back to work exclusively as we used to is probably not an option, that we're learning that some of these new ways that we've been forced to do business have opened up pathways for us to access new and vulnerable populations that perhaps weren't accessing our services before. And that was resonated through all three of the comments that of our commentators who shared with us today. So I know Alex is with us over the phone. I'm going to ask Alex if she would mind doing sort of roll call or attendance now. And then what we'll do right after that is we'll open it up to question and answer or comment. And we'll start with the Senate President when we get to that part of our call. So Alex, are you there? Oh no. All right, you know what? Roll call is not meant to be, if you're here, you're amazing. And if you weren't here, you could say you were here, because now we won't know, which is also fine. Because if you're here, you're meant to be here, and this is all being recorded. So I'm going to open it up now for questions, answers, and comments. And Senate President Sweeney, I'll start with you. If you have anything that you'd like to ask or comment on, we'll let you have the floor first.
Patricia, I'm listening to the challenges that you're having, and one of my questions, I guess one of my questions is, as we start opening hospital systems up again, do we have people that are willing to go back in and be that advocate, in the hospital? Because we're trying to do this. Like right now, if you go to an emergency room, you're not allowed to have someone with you. Well, we think we need to lift that restriction, just as if someone's giving birth, they should be allowed to have someone with them. So if we were to push this, especially what your organization deals with, you do have people that would be willing to go back and continue to serve in those roles, right?
That is an excellent question. And it's actually a conversation that we're having with coalitions and advocacy staff all across the country. And thank you so much for thinking of us. I think 100% we have providers and volunteers that with the right protective equipment would give anything to be by a survivor's side when they're in a hospital for this really traumatic experience. And also, though, we also really do always respect autonomy. And so how I see this really rolling out in New Jersey moving forward is lifting the restrictions so that for providers and volunteers that for which this feels appropriate and comfortable, we make every effort to have that available. And then also still continuing to, as we've been discussing in all these other service areas, continue to think outside of the box about creative ways that in places where maybe that's not possible because it's a more densely populated area that's been more hit by COVID and it might take longer for people to feel that sense of safety, that we're continuing to explore the really creative ways that technology can allow us to provide support. But 100%, I think when we originally made the call that it wasn't going to be an option for people to go into emergency rooms, there were people that were ready. They were ready to go in there anyway and put themselves at risk. We want to make sure that we're doing it as safely as possible. So the right PPE would be essential.
And, you know, Patricia, but my point is, as we start identifying, you know, as they're lifting, we have to make sure that this community is given the same, you know, opportunity to have someone to, you know, to help them get through the difficult times. So I got staff on the call, and we'll make sure that this doesn't get lost. That it's not just for birth and not just for an emergency or family, you know, that your organization gets included in this.
Thank you so much for that. And if I can take a point on behalf of our providers to also request that we consider what kind of protective equipment could be available as we're providing ongoing counseling, not even just in emergency rooms, but when we go back to our offices. We do know that some of our colleagues who are on the front lines right now have not been permitted to work from home. They're providing counseling services remotely, so they're still doing what we're doing. They're seeing their clients over video chat, but the providers are being asked to go to their place of employment without sufficient PPE available. And so we do consider ourselves to be essential workers, making sure that we are able to respond to survivors at the point that they do outreach to us for services is important for their long-term health and well-being. One of my colleagues, maybe it was Jill, who was talking about increased suicide assessments. One of you guys was talking about this, or am I dreaming this up? Somebody did, okay. Jeanne. And so, you know, we know that survivors of sexual assault are 13 times more likely to attempt suicide than non-survivors. Making sure that the point in time they need a counseling session or they need advocacy, that those services are available, will really help us reduce the long-term mental health impacts of victimization. And so as always, as you know, I said at the beginning, you are certainly no stranger to our work and to the work of our providers. And the fact that you're already thinking about us as essential workers and what going back to sort of business as usual will look like for us. Thank you so much for keeping us in the forefront of your mind. We really appreciate it.
And Patricia, just one last thing. When I think if there are roadblocks the government is putting in right now, if you can provide your concerns to us, again, we don't want this lost, or someone saying, how come, you know, because there's a lot of how comes right now. But look, I really do appreciate the job that this organization does. You're doing God's work. I say that. I'm not an overly religious person, but I know that you absolutely are doing God's work. I don't say that lightly. So thank you.
Thank you, Senator. And we couldn't do this without you. For those of you that might be new to sort of the policy space when it comes to sexual assault, over the last 6.5 years, the state of New Jersey has greatly increased state budget appropriations to support our work. And it's in no small part due to the Senate President's leadership and that of all of our colleagues in the legislature. When I started here in 2013, there was $900,000 in the state budget. And that's for 21 county-based agencies to provide 365-day-a-year services, 24 hours a day. those advocates that are leaving their Thanksgiving tables with their families to go to a hospital to support a survivor. We're all doing this work on shoestring budgets. And we've increased that appropriation to $6.8 million. And all of that money has gone to support an expansion of services. And still, even so, pre-COVID, we had 43% of our programs reporting a waiting list for services. And what it is there's an increased national dialogue about impacts and prevalence of sexual violence. More survivors are being able to identify that what's happened to them is in fact a violation and it's sexual violence, and they know that there are services available more than ever before. And so just as we're increasing our capacity, the demand is going up. And so we know that these are tough times, and we're with it. We're in it with all of you as taxpayers and as community members. Really trying to figure out how can we make sense and how do we not lose the great ground that we've been able to establish. Because to your point, Senate President, this work is probably more important now than ever before. So thank you. We're going to open it up for questions or comments from anybody else on the line. I know that many of you are calling in by phone. And so it's impossible for you to kind of like do the little thing and raise your hand or to write in the comment box. But if you unmute your line, I can actually see that. And then I'm happy to call on you if you have anything that you'd like to contribute or ask. You're welcome, Jewel. All right. So what we're going to do is we're going to package up this recording and make sure that all of our colleagues, both in our federal delegation and the state legislature, have access to this recording. I really appreciate, Jewel, you asked the names of our speakers, and we wrote them in the chat box, and we'll include that also in the written follow-up that we send out. But again, thank you to Jill Zinckgraf from the Domestic Abuse and Sexual Assault Crisis Center of Warren County, Karen Lopez from the Passaic County Women's Center, and Jeanne Manchin from the Middlesex County Center for Empowerment. Thank you to my colleagues at NJCASA who are on the line, who allow us to do this work, also thinking outside of the box and shifting nimbly in response to the needs of survivors in our local programs. Thank you to our colleagues in the legislature and all of your staff that joined us today. We all know that the staff are the people that help us get things done. And so we're so appreciative that you decided to spend some time with us today and share the information that you have gathered with your bosses and our colleagues in the legislature. We are here for you. We don't need to wait for us to have a policy briefing for you to reach out. We're so thankful for the relationships we have with all of you across the state. And again, please take good care of yourselves. We need you. Just as our survivors need our providers more than ever, we need you guys more than ever. So stay well, stay safe, and we will see you all very soon. Thank you for joining us.